My name is Abby Shonrock. I am a clinical assistant professor and the assistant director of transplant psychology here at PHHP in the Department of Clinical and Health Psychology.
And I am Laurie. I am a clinical associate professor in the Department of Speech, Language, and Hearing Sciences. And this is Picture This. What's one sentence you would use to describe your clinical work?
Okay, so I would say that my clinical work is multifaceted. I work with a lot of different types of people with a lot of different presenting concerns. And so the things that I see on a day-to-day basis are really kind of diverse and multifaceted.
I should have been thinking about my answer while you were answering yours. So one sentence to describe my clinical work: I'm able to meet a need in this community because I work with kids with that are struggling and learning to read. And there are more and more of those.
Do you feel like that's increased over the past couple of years?
It's hard to say. People say, with COVID, that we have a lot more kids struggling. I would say before COVID, I was seeing a lot of kids that were struggling, and I still do.
How did you get interested in your field?
All right. Well, I am a speech language pathologist. And when I finished graduate school, my area of interest was child language disorders, primarily spoken language disorders. And when I came back to UF for my PhD, I became involved in reading research. All of my clinical work now is working with kids and adults with reading disabilities, and my love from oral language kind of moved to written language.
Okay, interesting.
And how about you?
Yeah, so mine's kind of a longer story, but I was a student athlete in college, Division I.
What sport?
I played squash.
Oh, cool.
It's going to be in the Olympics in 2028, so everyone's going to learn about it. But when you're an athlete, you really recognize the intersection of mental and physical health. Through that, you get to see a lot of different ways that your mental health really impacts how you show up on the court. And I knew I wanted to work with people, but I didn't know how I could do that in a way that intersected both of those things. And during my time in undergrad, I found some research that looked at the impact of personality choice on physical activity type, or personality on physical activity choice. Through that, I found the field of health psychology, and then went to get my PhD in clinical and health psychology. From there, matched to UF here, our very own college, for my internship. And I got to learn about what transplant psychology is and grow, my basic health psych skills to become a transplant psychologist, essentially.
Well, I will say this is very timely because of the Olympics. I'm always amazed at these young people having the pressure to perform at such a high level. What's one finding within your clinical experience that has surprised you most?
Ooh, that's a really good question. Oh boy.
Yeah, that's a hard one.
Yeah. One of the things that I think has really impressed me is the resilience of human spirits and human individuals when we're put in situations that are difficult or really can be traumatizing and extended hospitalization. So overall, the experience that really has surprised me the most is just being amazed by how resilient people are in times of stress and difficulty.
It's not that I find it so surprising, but parents of children who are struggling, I mean, reading is a basic skill that you need to be successful in life. And what's amazing to me is that despite socioeconomic status, I meet with parents every day that are amazing in helping their child, finding what needs to be done to help their child. And it definitely, surpasses just having access. I see these parents that have little, but are doing everything they can to get their kid what they need. So
like parents adapting and finding a way to help their children.
Yeah, these parents that, work in 2 jobs, but they still are finding the time and taking the time off to bring them to the clinic. And it's, and not that I'm surprised about that, but it's that parents do this. It's not an easy feat to do.
Yeah. What's one question related to your work that you've always wanted to answer?
I would like to, be able to, not that I think this is possible, but to be able to identify at birth exactly what kids are going to struggle learning to read so that we can, we have a lot in the way of screening and identifying factors, but it would really just be nice if we could just figure out from birth, hey, this kid's going to struggle, let's do this.
For me, when I find questions that I don't know the answer to, I always want to dive into research. So a lot of my research that I'm doing now with the transplant teams here at UF and through PHHP are focused on answering some of those questions. But very similar to yours, one of the most recent questions that I've been looking at is how early intervention post-discharge from the hospital can improve quality of life and mental health outcomes, especially after LVAD. That's a hard question to answer because it's like we always want to know more and more about our fields, and that's why we do research. So that's my answer to that question.
With these kids that are sick, needing implants, it's that time before they get the implant, and then as they recover.
Right.
So that's.
Yeah, I think so much of our healthcare system is reactive rather than proactive. So like the early intervention stuff, exactly like you said, and how can we change that to make that better outcomes for our patients? So.
Yep, exactly right. Instead of waiting till they start to struggle.
Right.
Identify them early on. We have, in reading, there are a lot of very good screeners, but still, they're not exact. What do you hope a person impacted by your work will feel or be able to do as a result?
We see it on my service, patients who are pre and post-surgical. So one of the most important things about working with someone therapeutically, and this might be very similar for you, is giving them the skills and tools to set them up down the road and make sure that they're able to succeed, long-term, psychologically for us and cope with challenges that life brings. When I think about what I want a person to be impacted by is being able to use the skills that we have established in therapy to be successful, to cope with any new challenges or adjustments they might face because they have a chronic illness down the road.
So many of the individuals who struggle with reading and writing, as a result of it going to school, feel dumb because school is hard when you can't read or write.
Yeah.
And so I think the impact I have is when these individuals realize they're not dumb. Their brain just worked a different way, and that, they can learn to read, given the right interventions, but they're certainly not dumb. And I think that, it's so sad when you're, especially if it's like an adolescent, a middle school, high school kid, who's just struggled all his life, and he's in special classes, and he has a lot of skills that maybe aren't measured by grades in school. So getting through to that individual that they're not, that they're just as smart as anyone else. They just, need to learn a different way is, for me, uplifting.
Yeah, I could see how that would be really powerful for someone to be able to reimagine themselves as someone who isn't dumb or stupid, but someone who is very capable of achieving what they want in life, their goals.
Yeah, it's embarrassing when someone asks you to read something and you can't.
What is one thing that you will take away from this conversation?
I will take away all your insights in working with transplants. Yeah. I think it's very interesting. We all, or at least, I know a little bit about that, but you don't think about all those other little things that how it can affect the person as a whole.
Yeah.
So, I thank you for shedding some light.
Yeah, absolutely.
My knowledge in that area.
Yeah, I'm always so excited to talk about it. So it's definitely, I get enthusiastic. But I think the thing that I'm taking away from this conversation, which has been really meaningful, is how much, we're in totally different fields, but there's so much overlap in terms of our goals for the people we work with and the ways that you know, we all kind of have this common human theme of like trying to make our patients' lives better. So that's been really cool to hear about a different way that, you know, you're impacting people in a stage that, yeah, I would have never heard of unless I had done this.
All right, it's time to show your painting.
Oh gosh,
no.
the worst part.
Mine isn't that great.
Mine isn't either. Okay. All right. I drew a book because she talked so much about reading and working with kids and improving their lives. So sorry. Once again, I am not an artist. So
I think it's great. I love it.
yeah.
It looks like a book. And I'll let you guess what I drew. I drew hearts.
Yes.
Because of her work. And because that was an easy shape for me to draw.